Today marks 60 days of response to the Ebola outbreak since the first case was reported in Mubende district in September. And since then, the Ministry of Health is yet to receive emergency funding from government towards the response. Ministry of Health said it needed at least 76 billion shillings. Today, the Permanent Secretary at the Ministry of Health, Dr. Atwine, said they are finding alternative ways to finance the response.
We haven't received the money from government, but they have also allowed us to reallocate money from World Bank to use, which we are using right now as part of $6 million US dollars.
The ministry's response has largely depended on donor and partner funding, with the US cashing in up to 86 billion shillings, 6 of which was directly extended to the ministry. UNICEF has provided $8 million of the $12 million which they are willing to offer towards the response effort.
We are trying to coordinate under each pillar to make sure that the partners that are supporting that particular pillar, we agree who does what, so that there is no duplication, there is no wastage of resources, but also to increase that transparency as we implement this response of Ebola.
At today's meeting, the Ministry of Health seeks support to meet a 630 billion shillings financing gap in support of the water, sanitation and hygiene facilities in the country.
This money seems to be a lot, but actually it's little when we put the partners on board. And giving it the fact that it has a critical importance in terms of preventing the disease. So the gap is known, the partners are willing actually to reorient their funding, working with government, but also we need to lobby government to see that the partners are putting there, but also government is also funding it.
Dr. Anne Robbins, the Chief of Child Survival and Development at UNICEF, says that the availability of WASH services are key in Ebola response.
In the current situation that we're struggling with in Ebola, health workers are facing patients coming to their health facilities for regular services, and that's really important because many more children die of malaria than they will ever do Ebola. Like 350 a day in Uganda die of those 3 big killers: pneumonia, diarrhea, and malaria.
According to the Ministry of Health, Uganda is dealing with 3 pandemics, which are COVID-19, monkeypox, and Ebola, which has claimed 55 lives. The disease is mainly in the district of Mubende and Kasanda. Walter Mwesije, NTV.